uses to play with and to characterize abnormal tissues. And many details we can obtain without administration of CT contrast, without administration of IV contrast. In CT, in almost 95% cases, we need IV contrast to characterize the pathology, but in MRI, in 95% cases, we don't need, or 90% we don't need the contrast to characterize a pathology. MRI has also got its own limitations. It's a time-consuming procedure. It can produce artifacts like this. It needs expertise to interpret, and it is obviously expensive. Contrast agent used in MRI is nothing, a gadolinium-based contrast agent, which is injected followed by injection of 20 ml or 10 to 20 ml of normal saline. This is a side effect, long-term adverse effect which can happen after administration of IV gadolinium. It's a complication occurring in affecting the skin and subcutaneous tissues. The patients who are at risk for NSFR, dialysis patients, CKD patients, etc. So how to get best from MRI? Always ask a specific question and we'll provide you a specific answer, because the sequences can be tailored accordingly. What are the differences between CT and MRI? It's already been discussed. CT is very faster. We can finish the whole body scan in less than 5 to 10 seconds. It is less expensive than MRI, and it's less sensitive to patient movements. It is a short study. We can easily use in claustrophobic patients. Hyperdense objects like hemorrhage, calcification, bone, foreign body, etc. are better visualized in CT than in MRI. In MRI, the main advantage is lack of ionizing radiation and a better spatial resolution. So, last aspect, why MRI, or in other words, what are the clinical aspects of MRI? First and most important is neuroimaging. Neuroimaging is equal to MRI. No neurosurgery, no neurology without MRI. Indications, what not? Anatomy, anomalies, metabolic diseases, stroke imaging, infections, demyelination, tumors, trauma, dementia, hydrocephalus, everything. Stroke imaging, CT image, early stroke, lacunar infarcts in the right, basal ganglia is missed in CT. It's not visualized in CT, but it is easily picked up in diffusion weighted imaging of MRI. CT almost looks normal, but retrospectively there is some effacement of the cortical sulci here as compared to the right side. But diffusion weighted imaging of MRI picks a large MCA territory infarct and also a smaller infarct in the right coronary radiator. Posterior circulation strokes can be missed in CT because of the beam hardening artifact which occur from the temporal bones, petrous bones, but it is well picked up in MRI. Similarly, we know lateral medullary syndrome, we can see a small acute infarct in the lateral medulla, better seen on MRI. MRI is almost as sensitive as CT in detecting larger hemorrhagic foci, but smaller microhemorrhagic foci are better seen on MRI than in CT. So there are some conditions where we need to definitely skip CT. This is very important because in children and babies, maximum try to avoid CT as much as possible. Go for MRI to avoid ionizing radiation. Evaluation of headaches is a bit controversial statement, but most of the headache evaluations like migraine, etc., we should go for MRI. Suspected demyelination, infections, dysmyelination, vasculitis, space occupying lesions, pituitary lesions, etc., MRI is the investigation of choice. And investigation of cranial nerve pathologies, we should go for MRI. And non-contrast MR, angiogram, venogram are better done. In case of herpes encephalitis, CT shows some hypodensities, but MRI better pick the lesion. Pituitary lesions like macroadenoma, to know the compression of optic chiasma, to know the involvement of intracranial arteries, MRI is the better imaging choice. Meningiomas are extraaxial enhancing lesions which can present very late. Here we can see a large meningioma along the falx cerebri with significant mass effect. Schwannomas, cranial nerve schwannomas, this is a case of fifth nerve schwannoma occurring in the left CP angle. Peripherally enhancing, ring enhancing lesion in the left thalamus, which proved to be a tuberculoma with surrounding edema. There is a sequence called MR perfusion, which assesses the microvasculature of the lesion, and by assessing the perfusion values, we can differentiate between an infection. We can differentiate an infection from a tumor. We can classify the tumor whether it's a low grade or high grade or intermediate grade. We can differentiate benign from malignant lesions, etc. Another sequence, MR spectroscopy, assess the chemical composition of each lesion, and we can differentiate whether the tumor is, whether it is an infection, whether it is a tuberculoma, fungal granuloma, or a tumor. Fiber tractography to assess the white matter tracts. Coming to spine imaging, MRI is the investigation of choice in suspected infections, cord compression, cauda etc. We all know the most common pathology of disc pathology. Here we can see a moderate disc bulge obliterating the bilateral neural foramina and compressing the nerve root here. Spinal infections, TB spine, spine metastasis, spinal tumors like chordoma. Head and neck imaging, MRI is always superior to CT in staging head and neck malignancies. In cases of petrous temporal bone lesions and paranasal sinuses, MR complement CT images. In orbital lesions, MRI is the first line modality of choice. It's an axial CT MRI at the level of orbit showing an intraorbital lymphoma, a brachial cleft cyst in the neck. You can see a retropharyngeal abscess here secondary to some fishbone injection. Musculoskeletal imaging, lot of indications: occult fractures, stress fractures, marrow abnormalities, joint imaging, cartilage imaging, ligament pathologies, tendon pathologies, muscular injury, infection, tumors, etc. So this is a sagittal image of the knee joint depicting well the ligaments, menisci, articular cartilage, the epiphyseal plates, etc. This is a case of trauma with bone contusions and ligament injury. The thin white line seen in the epiphyseal plate is nothing but the articular cartilage. It can be very well delineated with the help of articular imaging sequences. Occult fractures, not well appreciated on X-ray but very well seen on T1 weighted sequence. Shoulder pathologies like rotator cuff tear, tendinopathies, etc. are better seen on MRI. Characterizing bone tumors, osteosarcoma. This is a case of osteosarcoma. We can know the extent of marrow involvement, in the involvement of joint, the involvement of periosteum, the involvement of adjacent soft tissue, etc. Can be well characterized on MRI. Gastroenterology, it always acts as a problem-solving tool in liver and pancreatic lesions. This is a CT image, almost looking normal, but MR imaging depicting a small hepatocellular carcinoma focus in the contrast study. MR enterography depicting the depiction of the fluid-filled small bowel loops. MR colonography depicting the colonic pathology. We can see a small enhancing lesion in the sigmoid, which appears to be a broad-based polyp. MRCP is nothing but magnetic resonance cholangiopancreatography. It is a non-invasive technique to assess the biliary tree. You can very well see the pancreatic duct here. You can see the hepatic ducts, the cystic duct here, common bile duct here. We can look for any congenital anomalies like pancreatic divisum, annular pancreas. You can look for any CBD calculi. You can look for any strictures, etc. are very well seen on MRCP images. See carcinoma axial sequence showing a carcinoma in the rectum. Early cancer staging, MRI is ideal. MR fistulography showing a fistulous tract in the perianal region with an external opening and an internal opening. Urology, especially useful in pediatric patients to detect congenital anomalies, useful in pregnancy, useful in patients with renal failure. MR urography showing the normal urinary tract. You can see a duplex moiety on the left side, double ureters. Carcinoma bladder, small tumor, early detection, MRI is useful. CA prostate for staging, MRI is the investigation of choice. This is the central zone of the transition zone of prostate, hypertrophied. This is the white is the peripheral zone, and we can see a small hypo, dark lesion here with extra capsular extension. The thin layer is a prostatic capsule. This is the case of CA prostate. Cardiac MRI coming in a big way, very useful in assessing congenital diseases, cardiomyopathies, etc. Breast MRI, Venugopal sir has already discussed. Problem solving modality in assessing breast implants, in assessing recurrence of carcinoma, multifocal CA breast MRI is a problem solving modality. An image showing a suspicious lesion in the right breast. Fetal MRI to assess congenital anomalies, placental anomalies, assessing twin pregnancy, etc. This is a case of Chiari-2 malformation with a large myelomeningocele, a tonsillar herniation, and an anterior abdominal wall defect here. So fetal MRI useful in assessing corpus callosal partial agenesis. The case of conjoined twins, better assessed on with fetal MRI. Last, I think in gynecology, the anatomy is very well depicted on MR images. You can see the uterus, you can see the zonal anatomy of uterus. This is the myometrium, this is the junctional zone, and the white is the endometrium, cervix, bladder, axial image, myometrium, endometrium, ovaries, polycystic ovaries you can see here. So the anatomical details are very well seen on MRI images. You can see the subserous leiomyomas, intramural leiomyomas indenting the endometrial cavity, intramural and leiomyomas, cervical Nabothian cyst. Pathologies like carcinoma cervix, we can see a hyperintense lesion involving the anterior and posterior lips of cervix without invasion to parametrium. A polypoidal mass filling the endometrial cavity, case of carcinoma endometrium. So local staging of gynecological malignancies, CA ovary, CA endometrium, CA vagina, etc. MRI is the investigation of choice. To summarize, though expensive and time-consuming investigation and having a complex physics with too many sequences and difficulty in interpreting images, it is a relatively safe modality but with definite contraindications. Please ask specific question to get the right answer. It's an invaluable tool in the diagnosis of various diseases from head to toe. Chief modality in neuroimaging and musculoskeletal imaging. It's a problem-solving tool in abdominal pathologies and invaluable tool in local staging of most of the malignancies, especially gynecological malignancies. So, just to animal MRIs can also be done. Thank you.